I am Dr. Vijay Krishan. I am a practicing physician in West Delhi for the last 42 years. And today our topic of discussion is understanding hypertension. So, discussion would be on what is blood pressure and how we can prevent it. So, generally everyone would like to know how blood pressure occurs and how we can prevent it. So, what is blood pressure? Blood pressure is the pressure exerted by the blood which is pumped by the heart on the walls of the arteries. Whenever heart beats, it pumps blood forwards, and the pressure which is exerted on the walls of the arteries is known as blood pressure. So, when there are two types of blood pressure, systolic and diastolic. When the beating heart, when it pumps, it gives us the systolic blood pressure, and when the heart rests, that blood pressure is known as the diastolic pressure. In common terms, we can call it the upper blood pressure or the lower blood pressure. So, how does it occur and what is hypertension? The normal blood pressure in a person is a reading of 120 by 80, 120 being the systolic and 80 being the diastolic. So, if the blood pressure is beyond 140 by 90, it is labeled as hypertension or high blood pressure. And because it does not have many symptoms or it does not show any effects, it is known as a silent killer. Hence, it is very important to diagnose it and to keep it under check by various means which we shall discuss in the coming minutes. What are the risk factors that can increase the blood pressure or which cause hypertension? First is the age. As we go on aging, as the age rises, the blood pressure comes because the arteries, they stiffen up and the pressure on the arterial walls increases. Then the second would be family history of high blood pressure. If we have a family history, our parents or brothers, sisters, anybody has hypertension, then that person has a more risk of developing hypertension. Excessive salt intake. If a person is taking excess salt in his diet, then he is more likely to develop hypertension. Not eating enough foods containing potassium can increase blood pressure and the risk of stroke and chronic kidney disease. So, fruits containing potassium, green leafy vegetables, these are very important in our diet. If we keep on consuming it, then the chances of developing hypertension is decreased. Then eating processed and fatty foods. Nowadays there is a fashion of eating outside food, pizzas, burgers, which contain lots of processed food. They increase the fats throughout the body, and which makes the heart work harder, and it has to push extra blood through the body. Hence, hypertension increases. And lack of physical activity. Many people are having a sedentary lifestyle. They do not do any exercise. Those people have more chances of developing hypertension in their life. And the last one I would label is stress. Everyone nowadays has some stress, whether it is related to your work, whether it is financial stress, whether it is family stress, whether it is stress in the office or at workplace. But if one knows how to manage that stress, how to keep that stress under control, then he can always keep a check on his blood pressure. Otherwise, the hypertension would develop and it will cause problem in his life. So, most important is early and accurate diagnosis is very important. Only then measuring the blood pressure is very important, which we normally measure with a sphygmomanometer or a BP instrument. Previously we used to have mercury instruments. Now digital instruments are there which are freely available. One can keep at home and keep on managing. When the blood pressure is too high, then some symptoms develop like early morning headache or tiredness or vision problems, buzzing in the ears, fatigue, nausea, vomiting. If person is experiencing any of these problems, then he should check his blood pressure either at home or go to the doctor and get it checked. And so fortunately the high blood pressure can be easily diagnosed just by a machine. And if it is usually measured with an instrument, as I have told you, BP instrument, and normal reading I have told you it is 120 by 80. If the blood pressure level I have told you is more than 140 by 80, then the person is labeled as hypertensive. On May 17th, every year we celebrate the World Hypertension Day. It is a day which is dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer. So ensure that your blood pressure is measured and control it is elevated. Risk can be prevented and reduced by taking steps towards a healthy lifestyle, by doing regular exercises, taking a healthy diet, quit smoking if you are doing, and regular blood pressure monitoring, stress management, adherence to your medicines. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid delay or reduce the need for medication. So let's take a look at the strategic one by one. Regular exercise or physical activity is very important. Just simple walking or jogging or swimming for 30 minutes reduces the risk of blood pressure by 11 millimeters of mercury. So see the importance which even the drugs don't achieve. Just by simple exercise you can reduce. Then maintaining a healthy diet which is more of avoiding fatty foods and taking more vegetables, green leafy vegetables, fresh fruits, it can reduce the risk of hypertension. Avoid processed foods, eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in the diet and avoiding alcohol consumption. So there are various types of diets which are proposed throughout the world, like DASH diet or Mediterranean diet. But the main features are these which I have told you, that there should be less sodium, more potassium, less of saturated fat and total fat. DASH diet, which is very common or popular, stands for dietary approaches to stop hypertension. That is meant by diet. We have to reduce the sodium in the diet, we have already discussed. Always when we buy food or processed food from outside, we should read the label, see how much salt it contains. If it is containing too much salt, we should try to avoid it. And never put extra salt in your vegetables or in your dal or anything which you are eating, because that will increase the risk for developing blood pressure. Just 1 level of teaspoon of salt, it contains 2300 milligram of sodium. See how high the sodium is there. So you should avoid putting extra salt. Next important step is to quit smoking. Smoking itself hardens the arterial walls, and so when the blood is being pumped by the heart, the blood pressure increases. Then the next important thing is regular blood pressure monitoring, because unless you monitor your blood pressure, how will you know whether it is high or low, and how will you treat it? So self-monitoring or visiting your doctor regularly for measurement is very important. Stress management is the next important topic. As I have told you, that by learning how to relax and manage stress can improve emotional and physical health and lowers the high blood pressure. So stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. And the last important step is adherence to your medicine. The medicine which has been prescribed to you by your doctor is according to your age, according to the level of your blood pressure, and it is very important. Do not try to reduce your medicine or stop it or change it without the consultation of the doctor. So, if we sum it up, then adapting a healthy lifestyle can help us enjoy a long and healthy life, and high blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important, and it will prevent cardiovascular diseases, kidney problems, strokes, even eye problems. High blood pressure can lead to all these problems. Brain stroke is a very common complication. Heart attacks, cardiovascular diseases, heart failure, enlargement of the heart, chronic kidney disease, sudden blindness, all these problems are associated with high blood pressure. So that is why, because high blood pressure itself won't do you anything, it will not harm you, but it is harming your important organs. So it is very important to keep it under check and adhere to what we have already discussed. Thank you.